For 5 minutes.
Mr. Chairman, it's clear from the scope of the bills that were about to be discussed that the spike in opioid and heroin abuse directly impacts every district across the country. And we know that the current opioid and heroin epidemic's making headlines nationwide, and I've heard as recently as last week from Hoosiers about the personal and tragic impacts this epidemic is having on families. In Indiana alone, from 1999 through 2009, health officials saw a 500% increase in the rate of drug overdose deaths. This epidemic didn't happen overnight, and it's not going to be resolved overnight. It's impossible to point to one specific reason for why it spiraled out of control to a point where in Indiana and across the country overdose deaths now are surpassing motor vehicle-related deaths. But the one thing we do know and that we have learned is that about 80% of all heroin addicts started down that road with an opioid prescription. Providers across the country in my home state in Indiana are working to stem this tide, and I applaud them for that. Through conscious efforts to crack down on overprescribing in one of my counties, Grant County, Marion General Hospital successfully dropped the number of pain prescriptions written over the past year by 100,000 pills in 1 year. This is one example of the efforts of those on the front lines of this epidemic undertaking to fight back against it. Prescribing physicians, pharmacists, first responders, law enforcement, and most importantly, family members of addicts are working in our communities every day, and we must ensure they have the best guidance, support, and resources to be successful. In drafting prescriber guidelines for pain medication, the CDC has taken a significant step to support prescribers. They understand that the overprescription of opioids is a serious problem and that clear guidelines for prescribers need to be implemented to help address our nation's growing heroin and opioid abuse crisis. H.R. 4641, which I introduced with our colleague Representative Kennedy, would examine these guidelines and ensure that opioid prescribing practices are reviewed, modified, and updated where needed by an interagency task force and expert stakeholders from the prescriber, patient addiction, and recovery community to reflect best practices going forward. I'm grateful that our leaders, Chairman Upton and Pitts, Ranking Members Pallone and Green, recognize the seriousness of this epidemic, and I look forward to consideration in the House of this and all of the other solutions that we have to help providers and patients stem the tide of the opioid abuse. With that, I yield back.